So I have Dr. Arif Ali Awan with me from the Ottawa Hospital, and I just wanted to ask you a couple of quick questions. We're going to have a quick little discussion about precision oncology in Canada, and maybe we could start with what is the state of precision oncology in Canada at the moment in 2024?
Thanks so much, Sabrina. So I think when we look back at how we're treating patients with cancer over the last few decades, I think precision oncology has made a major advance in the care. So now we can select and find out exactly what's wrong in the cancers that some patients have and treat it specifically. So sort of targeting the Achilles heel of the cancer, and we find that patients are living longer, and some with oral medications where they can travel, spend time with their families, and have good quality of life. So the uptake of precision oncology, I think, has been variable in different countries, and we've seen the same in Canada as well, where certain provinces are testing patients. Some academic centers may have access to testing through research trials, and other community hospitals may have different access to testing. So what we're trying to figure out is really what is happening at the grounds level within Canada. Do patients uniformly have access to molecular testing in different provinces, whether they live in cities or urban areas, whether they go to an academic hospital with clinical trials or community hospital with clinical research or with a different kind of clinical trials. So it's trying to really find out what's the current lay of the land in Canada.
And so, I mean, I think this is a really good segue for me to ask before we talk about how we're going to do this. But do we know what's happening across Canada?
So I think we have some provincial guidelines which have emerged in the last year or two, particularly in Ontario, where there's more uniformed requirements by the Ontario Health CCO about what cancers should be tested for which tumor sites. But some of us clinicians would think that's not necessarily the most up to date based on the data and the treatments that we see at the conferences we present to, and it's certainly not uniform across the country. So we know there are provincial guidelines there, but what is really happening, within Ontario and to other provinces and territories within Canada, I think it's a bit of an unknown.
And so, how are you planning on addressing that?
Yes, so it's a good segue to what we are really trying to do here is to do a survey amongst initially starting with healthcare providers treating cancer patients within Canada. So these could be clinicians, could be pathologists. What are the specialties that care for patients with cancer, to figure out exactly what is being tested for different cancer types within Canada. Is it being tested in the hospital, or are these tests being sent elsewhere? But then also really identifying what are some barriers to adoption of precision oncology in Canada. So is it the knowledge of this sometimes complex field? Is it lack of informatics or bioinformatics support? Is it more education sessions that are required? Is it the infrastructure at the hospitals or different regions within the country? So really trying to understand what is being done, but then also understanding what are some of the potential barriers. So then perhaps down the road, we can know what the problems are and address some policy changes, but then also come up with specific research questions that really would impact care at the end of the day.
And so the survey is going to be open for 60 days?
I think that's our plan, to have the survey open for 2 months and to reach out all the different provinces and potentially territories and have and get a good landscape of what's being done in Canada at the end of the survey from both clinicians and from pathologists. So then we will publish our results and have and discuss the next steps.
And who would you like to see fill out the survey?
So I think this is more targeted towards pathologists and clinicians who are treating patients with cancer. So if we have, it doesn't matter whether you're community, academic, whether you do research or not, how big of your practice is. If you're involved in care of patients with cancer, it would be fantastic if you could help us with the survey, so we could hopefully implement better changes and provide better care down the road for patients with access to molecular testing and targeted therapies.
Yeah, and so specifically solid tumors, because there's no...
Yes, so our focus is predominantly on solid tumors for this, and again, you're looking at testing that would inform decision making when it comes to targeted therapies, and not primarily focusing on potentially other assays that are done for example, for diagnosis or selection of or for remitting chemotherapy, focusing predominantly on solid cancers and targeted therapies.
So maybe just one last question, just to end it off. What are you hoping to achieve with the survey?
So I think if you're able to get a good representation across the province, where we can see what is being tested, what are some of the barriers, I think that would be fantastic to help us understand, again, the landscape, the barriers, and then we could implement further projects and collaborations down the road where we address those.
Yeah, and so across the country. So we're looking for people to fill out the survey across the country.
Exactly.
Well, wonderful. I'm going to share the survey in the link at